Health headlines. November is Diabetic Eye Disease Awareness Month. So what is diabetic eye disease? How early can it start after a diabetes diagnosis? And what treatments are out there and available?
Yeah, a lot to get to. Joining us this morning, we have Dr. Kristen Nwanyanwu, Yale Medicine ophthalmologist and associate professor at Yale School of Medicine. Doctor, first of all, thank you so much for your time today. It's great to see you.
Thanks for having me. I'm really delighted to be here.
Oh, it's wonderful to have you. And so talk to us first here. What exactly is diabetic eye disease, and how does diabetes affect vision? This feels new to me.
Absolutely. So when you have diabetes, the body has trouble managing blood sugars and your blood sugar is increased. That increase in blood sugar causes inflammation in the body and impacts vessels and different organs in different ways. So you may have heard about kidneys or having heart attacks and strokes. The eyes have vessels too and get impacted. So in the eyes, you get inflammation, and what happens is those vessels don't work well, and they leak and they bleed and they break, and that makes diabetes the leading cause of blindness in working age people.
Doctor, how early can diabetic eye disease begin after someone is diagnosed with diabetes? What's the time factor there?
Sure. If you have type 2 diabetes, which is the most common, a lot of times people will have that and they won't even know it. And so actually, right when you get diagnosed with type 2 diabetes, you really need an eye exam right away to make sure that you're not having challenges because of that. If you have the type 1, that's oftentimes found in younger individuals, in that you actually have about 5 years before we see challenges related to eyes. So I always say when you get diagnosed, get yourself an eye exam right away so that you can make sure that your eyes are protected.
So let's talk about treatments here. What treatments are available if diabetic retinopathy or macular edema is detected? Did I say that correctly? Probably not.
Sure. So if you have diabetic retinopathy or macular edema, we know how to treat them. And in the early stages, we actually will have people do their diet. So diet, making sure that your blood sugars stay in range, that my endocrinology colleagues say. And then if it gets advanced enough where it requires treatment, we have injections for your eyes, we have laser treatments, and we've known how to keep people seeing with diabetes for a very long time, which is why we're here making sure people know to make sure you get checked, because you can have excellent vision and still have challenges. And we want to keep our patients with diabetes seeing well.
Macular edema, doctor. Thank you so much for making that easier to understand.
Doctor, do you think if more people knew about a connection between diabetes and eye disease, they would be more vigilant about treating their diabetes? Is that fair?
I do. It's, people don't want to lose their sight. It's second to having cancer, right? People don't want to get cancer and they don't want to go blind. And this is a leading cause of blindness in working age people. And so that connection between how well you manage your blood sugars and then even that screening. So we know that even if you have excellent control, after 25 years, you can have some changes. But what we want people to know is come get an eye exam so that we can screen and make sure that your eyes are safe and keep you seeing well to do all the things that you want to do with your families.
It just reiterates how important it is for basic health. It's all connected. Doctor, thank you so much for your time today. This was great information.
Yes,
thank you.
Appreciate
Thank you so much. Have a great day.
You as well.